Hello, my name is Kelly Reagan and I'm a student of physical therapy at UAMS, and I'm going to be showing you guys how to properly wash your hands and put on and take off your personal protective equipment. So the first thing you're going to do is wash your hands. So you're going to turn on your water and you're going to wet your forearms and your hands. Then you're going to apply your soap, preferably foaming soap, and you want to make sure that your full amount of friction time is at least 30 seconds. So I'm going to scrub the palms, 2, 3, 4, 5. You're going to get the in between your fingers, 2, 3, 4, 5. You're going to get the thumbs, 2, 3, 4, 5. You're going to get your wrists, 2, 3, 4, 5, and the forearms, 2, 3, 4, 5. All right, then you're gonna make sure and get underneath your fingernails, 2, 3, 4, 5. All right, now that we're all scrubbed, we're gonna rinse off. Just gonna make sure and put your fingers down, get all the soap off. You're going to grab your paper towel and wipe off your hands first, completely dry. You're going to discard this paper towel. Then you're going to get a new clean paper towel, turn off your water, and discard this paper towel. All right, now that our hands are clean, we are ready to put on our personal protective equipment. So the first thing you'll do is you'll put on your gown. We're going to tie this nice and tight. Okay, then we're going to tie bottom of our gown nice and tight. All right, then we're ready to put on our mask. You want to make sure that it's covering your nose, and you kind of want to seal this area, your cheeks, and underneath your chin. Then you're going to put on your cap. And the important thing with putting on your cap is you want to make sure all of your hair is completely tucked in. Ladies, and gents, I guess. So making sure all that hair is tucked. Then we're going to put on our gloves. And the tricky thing about the gloves is you want to make sure that you tuck all the sleeves of your gown into your gloves so that there's absolutely no skin exposure. Okay. So now that we are all sterile, we are ready to enter the patient's room. Now we're going to pretend we just came out of the patient's room and we need to take off. So the first thing you want to make sure is all of this would be soiled, so you want to keep it on the inside. So we're going to take off our gown. And keep all the soiled part on the inside. I'm going to kind of shimmy that. And I even make sure and take off my gloves during this part as well. We're going to wrap all that and keep the soiled part on the inside. So we're going to discard the soiled. Next thing you're going to do is take off your cap, one finger. You're going to reach underneath pull it around, and you're gonna discard that cap. The next thing you're gonna do is take off your mask, one finger, you're gonna discard the mask. The last thing, before you touch anything, you wanna make sure and wash your hands again. So we're gonna go through the whole hand washing process. You're gonna turn the water on, wet your arms, get your soap. You're gonna scrub for a total of 30 seconds of friction. We're getting the palms, 2, 3, 4, 5. And the fingers, 2, 3, 4, 5. And your thumbs, 2, 3, 4, 5. And then your wrists, 2, 3, 4, 5. And the forearms again, 2, 3, 4, 5. And then your fingertips, 2, 3, 4, 5. All right, now that you're all washed, go ahead and rinse. Once again, gonna dry. Discard. Take a new clean paper towel, turn off your water, and discard this paper towel. And you're done.